Gynecomastia is very commonly seen in nowadays. Almost 70% of the men having this issue. Why it is so high nowadays? Same way you can see PCOD problem in females. The lot of hormonal imbalance happens in the males as well as in females. So in male they are getting the male breast development, and female they are getting the PCOD kind of issues. So a lot of theories are postulated for developing and development of gynecomastia. We know that it's a hormonal imbalance. The female hormones comes first and develop the breast tissues. Why it is happening? A lot of theories are postulated, but commonly what we understand is we are going for a lot of junk foods with a lot of preservatives that contain a lot of chemicals in it, and using a lot of plastic related things, and so many things are interrelated. So avoid, give them a very healthy, nutritious food, a lot of fruits, vegetables, and avoid using plastics, and avoid using the junk food which comes with the preservatives. And these are all the ways we can prevent our kids not to develop this kind of issues. And coming to the parents of guys who develop the gynecomastia, that is the male breast. What are the symptoms? What are the things you can see from them? They don't go out with their friends for a swimming pool, or you call them for a temple in any Kerala temple, they don't go. Basically, they need to remove the shirt in front of others, and even in the house, they don't remove the shirt or baniyan. Without the baniyan, you can't see them in the house also. And normally they don't sit straight like this. They always sit like this. Basically, they want to hide the projection in the chest. So these are all the commonly noted symptoms among the kids. And nowadays kids, how they are smart, and how the peer groups are so bullying them in each and every issues. These things you have to understand deeply. These are very psychological impact what they are going to get. A lot of my clients, when they're coming in the 20s and getting operated by me, they told me clearly that childhood is not at all ever so pleasant, so stressful, so traumatic, so pathetic, and they go for so much of depression during the childhood days because of the bullying by the other peers and other friends. So as a parent, what you have to understand is support the child, support your son. Obviously, he's going through a lot of deep depression and deep psychological impact. You don't believe, a lot of people attempted suicide because of this issue. And I have treated 2-3 clients of mine who already underwent a suicidal attempt. Parents identified the cause later and they brought him to me. So understand the psychological concerns. These psychological insults are very deep rooted. You don't realize how much they are going through. And as a parent, what you need to do? At the age of 12-13 years, if you find that kid is developing the chest development in the form of breast development, show it to an endocrinologist and show it to a cosmetic surgeon, that means a plastic surgeon. So they'll guide you properly. Even nowadays the trend is, even the youngest kid, you need to operate, because before this thought goes into his mind, it has to be. The commonest age group who comes to us for the surgery, for the gynecomastia, is between 25 to 30, because parents won't support the surgical thing, so they earn their money, they come without their parents' knowledge and come to us and get corrected. Why? As a parent, understand that psychologically, support at the young age, so that they can get rid of this issue in a very young age, so that it won't register in their mind. Dear parents, what you have to understand is there is no non-surgical treatment for gynecomastia all over the world. Only accepted treatment and only effective treatment for gynecomastia is surgery alone. So don't get confused with various non-medical professionals advertising online for some medications. So only options we left behind is only surgery. So meet a plastic surgeon and train cosmetic surgeons so that they can help you to get rid of these issues. Even I have a client who came at the age of 65 and got corrected this issue. This nagging problem won't solve till we correct it. It will be in their mind till we die. So correct this gynecomastia as early as possible and make the kid happy.